Adderall is another common drug in this category, also called methylphenidate or Ritalin. And it's a common medication used to treat ADHD, or attention deficit hyperactivity disorder. But like, it seems a little nuts to give a drug that functions similarly to a stimulant to kids who are already experiencing hyperactivity issues. So one of the issues in ADHD is that the frontal lobes are pretty underactive and thus unable to inhibit improper responses. So these drugs will help to boost to that inhibitor, which leads to decreased hyperactivity. So that's the structure of how this works. The way this works is it does boost dopamine and norepinephrine, but at least in clinical doses, they don't produce dependence. This is why you commonly might get it prescribed for ADHD. Typically leads to increased attention and conversely difficulty sleeping. Yeah, so regardless of whether or not you have ADHD, you might know some friends or do this yourself who will take these drugs before an exam to improve your focus. All people will respond to these drugs in similar ways, which frequently leads them to being used off-label for reasons they're not intended to. Also in this category is MDMA or ecstasy. So it's related to amphetamines and a natural hallucinogen, but it tends to increase your heart rate, it increases your blood pressure, your body temperature. It also is interacting in similar ways as serotonin does. That's why it's involved in mood, appetite, and sleep. So it's mimicking serotonin here. It's going to be taken up by serotonin transporters, which causes them to release serotonin from their vesicles. It becomes trapped then in the synapse, and it kind of just interacts with the receptors of the postsynaptic cell continuously. Some effects of consciousness, it typically will increase your sociability and your heart rate, but it has some long-term detrimental effects too, because it can often lead to convulsions or even death if you take too much of it. Here's a video on that.